This podcast is for informational and entertainment purposes only. It is not medical advice.
Hello. Today we're talking about health and the delicate relationship between our thoughts and our bodies, stress and resilience, and the powerful ways our mindset may be shaping our well-being in ways we don't always realize. Welcome back to the Happy, Healthy Her podcast, the space where we discover, inspire, and empower women in midlife and beyond. I am Lorraine Kihm. I am your mindset wellness coach and your host for today's conversation. And as always, I have my two lovely friends and co-hosts here. Ladies, introduce yourself.
Hi, I'll go first. I'm Tracey Male. I'm a health empowerment coach. Thanks.
Hi, I'm Cynthia Penner, and I'm a certified menopause coaching specialist.
Thank you. Wonderful. Today's conversation is about something many of us experienced: headaches, digestive issues, fatigue, brain fog. And then someone says it must be stress. Stress that somehow shows up physically. But stress is such an intangible thing, isn't it? How do we really know? You go to the doctor, you take some tests, they all come back normal, and yet the symptoms are very real. So today we're talking about the powerful connection between our thoughts, our emotion, and our physical health, and why understanding that concern may be one of the most important things we can do for our long-term well-being. We welcome our guest today, Dr. Julius Torelli, a cardiologist with more than 40 years of medical experience whose work has evolved towards a holistic approach to health and prevention. Through his platform, Gratefully Well, he explores how mindset, emotional health, and gratitude can influence the body in ways that traditional medicine doesn't always address. Welcome to the show, Dr. Julius.
Thank you very much. I'm honored to be here.
Welcome.
Wonderful. Well, we usually start out with who you are and what you do. So you spent decades practicing cardiology in the traditional medical model. I'm curious, what experiences along the way led you to start looking beyond that model and to explore the deeper connections between mindset and physical health?
Well, thank you for that. It was a wonderful introduction. So it actually started for me, believe it or not, way before, even before medical school and before college. I was 16 or 17 years old, and I ran across this book on the placebo effect. And I was absolutely fascinated with this thing, this placebo effect, the sugar pill effect. When you give people a sugar pill 15 to 30% of the time, they get better. And I like that didn't jive with anything that I had ever heard of or knew at that time. But then I got to college, and I took I was a psychology minor, and didn't really learn anything about it then. I got to medical school, so I'm sure I'll learn about this placebo effect now. And the only thing I really learned about it was the pharmacologist who complained. They saw it as a nuisance because the pharmaceutical companies have to do these placebo-controlled trials because of the placebo effect to show that their $100 billion drug works better than a sugar pill, which means a sugar pill works. And so I always thought that was funny. But even with my colleagues, my classmates, they, I would say, hey, what if we got this thing to work like instead of 15 to 30% of the time, like 30 to 60% of the time? And like no one was interested. It was odd, very odd. But my last week of medical school, I was doing I don't believe in coincidence. I think everything happens for a reason at the right time. And it was literally the last week I was doing a family practice rotation, and I saw a wonderful woman, middle-aged woman, who came in with nausea, vomiting, and dry heaving for like 3 days. She was really sick, really dehydrated. I didn't know what was going on. So we put her in the hospital, we hydrated her, and ran some tests. And over 3 days, everything came back normal. So I was going to discharge her. She was feeling still a bit peaked, but she was feeling better. And I was going to discharge her, and I was sitting there, and I was filling out her discharge instructions. And I was making some small talk, and I said something corny like, well, we're going to get you home where you can get some rest, right? Because you can't rest in the hospital because everyone's always bothering you.
Right.
And she said something very curious. She said, "Oh, I wish." And I said, "You wish? What do you mean you wish?" She says, "I wish I could go home and get some rest." And I was like, well, "Why can't you?" She says, "Well, in the last 6 weeks, my husband left me, my dog died, and my house burned down."
Oh,
Oh my gosh.
What?
And I was sitting there, and all of a sudden, the first thing that happened was it became intuitively obvious to me why she was sick. Like, oh,
mm,
like that was the thought. That's why she was sick. That was that was the first thought. The second thought was, wait a minute. I'm in this at this point. I was 2 days before I was graduating, and I said, in 2 days I'm going to be graduated, and I'm finishing my education, and I didn't learn anything about this. So that was kind of the
mm,
second thought. The third thought was, well, if I didn't learn anything about it in medical school, maybe it's not a thing. And so then I was like, And I said, well, maybe, I have this whole medical school library available to me. I'm going to go and read about this. And I went, wait a minute. I don't even know where to start. I don't know where to look to read about this. I was very curious. And then, I spoke with my attending physician, the family practice doc, who was an older guy who was very experienced. And he was like, it was probably a virus or something, and which is so the first thing I learned was that if we have no idea what's going on, we call it a virus.
Yeah.
And again, it was a busy time for me. I was in Tampa. I was moving to Cleveland. We were packing and all this, but that patient not stayed with me, and not only stayed with me, but I saw this patient now over and over and over again. Not so much in the hospital, but even in the hospital, you saw this, but certainly in practice. And then when I got into practice, I started to see that this wasn't just me seeing these patients. I was a cardiologist, so I was seeing a lot of, chest pain and palpitations, which most of the time, yes, you got to make sure it's not a heart attack or unstable angina, heart disease, whatever. But the majority of the time, especially in the office setting, it's what we call non-cardiac chest pain or, mitral valve prolapse syndrome or something like that. But this was present, I found, like in every specialty. Every specialty had their own form of it, right? So neurologist had, migraine headaches or tension headaches or cluster headaches or whatever. Most people coming with headaches don't have brain tumors or something physical causing it. Neck pain, back pain, chest pain, belly pain, very common. Most people who come in with belly pain don't have appendicitis or Crohn's disease or bad gallbladder, and then we call it irritable bowel syndrome, right?
Yeah.
Muscle aches. We call fibromyalgia, chronic fatigue syndrome. All of these sort of things, and so it became obvious to me that what we do in Western medicine, modern medicine, is we're very good when we find something physical, right? So the technology, the improvements in technology, the advancements in technology in my 40 years of practice, I mean, it's astounding, really, the things that we can do today. We can replace a heart valve basically through a needle stick, which is incredible. But,
wow.
So if someone comes in with an acute issue, and most of these are acute, a broken bone, belly pain with an appendicitis, a heart attack, a tumor that you can cut out, we're generally very good at taking care of those kind of issues. The issue is, so I call those physical dimensions of health, right? If something physical is going on, we're pretty good. But what I found is the great majority of people who come into the doctor's office with all of those complaints don't have an acute illness, and so that's, I think, where modern medicine struggles. And we pay, let's just call it 100% of our attention on the physical, and we virtually ignore, it's not 100%, it's 99.9%. We ignore the what I call the non-physical dimensions of health, which, as you were suggesting, is sort of mental health, emotional health, behavioral health, cultural health, social health, spiritual health. These are all important components of health that I think need to be addressed even, early on, not just because even if you have a physical symptom, if you have, cancer, right, there's still an emotional component to that you're going to have to deal with. There's a social component to that is important to deal with. And we have studies that show this, but we tend to ignore it. Anyway, that's a very long-winded answer to how my practice evolved toward this.
No, absolutely.
Oh.
Ladies, do you have any
Well,
comments?
I'm curious, while you're figuring this all out, did you ever revisit that first patient and give her a quote unquote sugar pill? Like, were you able to help her with the
You know,
placebo effect?
that's a great question. So with her, it was, as I sat there and became obvious, like I didn't know what to do with this patient. Like there was nothing I had learned, like, even after my training in cardiology, I was good at treating any kind of acute illness. I was very well trained. But when I got into the office, one of the first patients I saw in the office, this is after my training and joined this group in Greensboro. And it was a 28-year-old female who came in with chest pain and palpitations, who had no risk factors for coronary disease. She had no risk factors for heart disease. And like, I literally, after all that training, I literally didn't know what to do. I was like, well, I did an ultrasound because that seemed, make sure she didn't have some kind of congenital heart disease or something strange. But her exam was normal, and the echo was normal, and then it was like, what do you do now? There's nothing physical going on. And so what I did with that patient from my fourth year of medical school, I didn't know what to do, and I like sat there and I turned human. Like I just started talking with her. Basically, I sat with her. Maybe that's a better way to say it. And I remember saying like, that's a lot. I don't, and I appreciate you guys talking about stress because I don't use that term. I think it's too ambiguous and means different things, as you were suggesting, to different people, especially different, professions. Like stress to an engineer, like a civil engineer who builds bridges. Stress is a completely different concept than it is to, say, a physicist, which is very different than it is to, say, a psychologist. And so I just tend to use the word emotion or emotional overwhelm. I think this woman had emotional overwhelm, and just sitting, with her and letting her sort of cry and letting her sort of express that is all I knew to do. So it was a bit unnerving because I really didn't know what I was doing. But that's the only thing I knew to do.
I think that's fantastic.
Yeah.
You didn't know
that
what to
helped
do,
her.
but you did the exact right thing.
Well,
Right? That's,
yeah,
oh
but I
my
didn't know I
goodness.
was doing the right thing. I did.
No, no, of course not, right? I just think of my own. I was in the hospital 2 years ago, almost 3 years ago now, with a hypertension event.
Yeah, yeah,
And they
yeah.
didn't
Wow.
know at the time, they didn't know what that was. They thought I was having a heart attack. My blood pressure was through the roof. I was in the hospital for 4 days. They couldn't bring it down. They did an angiogram. They did all the stuff, right? And then finally it did come down. But again, that was absolutely, now I know more, right? It was all stress. It was
Yeah,
just, I had a
yeah.
lot going on, and that's what caused it. It's
Yeah, and
crazy.
again, that's where we and the challenge actually has been or was, you know, because I didn't have literally with through my education and then my training in internal medicine and cardiology, you don't get any training in this, right? And so it became a challenge for me. So I opened up, after I was with a big group, I was there for a while. The group was getting bought by the hospital. I wasn't interested in that, so I went solo and opened up. This is in 1999, so 25 plus years ago. I opened up a center. I called it the Integrative Cardiology Center, but we had counselors, we had yoga, we had Tai Chi, we had acupuncture, Chinese medicine, massage therapy, and I was the only MD, only physician there, and so we sort of shared these patients, but I ended up, mostly being, the one doing most of the stuff with these patients, and so I kind of developed mostly my own techniques, but got trained in some other things as well. But it was a bit of a challenge for sure.
Well, you might be surprised or maybe not surprised that most of the guests we have on, degreed, certified, experienced guests, tell us over and over again, I did not learn this in medical school and in whatever their field. And when it comes to nutrition, they don't learn it. When it comes to menopause, especially menopause, they don't learn it. When it comes to these, types of issues, emotional, psychological, spiritual, like you said, I mean, there just is zero training. I call it the lifeguard profession. They are the lifeguard medical profession because basically until you're drowning, they don't come, or they don't have the tools to help you until you're in that dire situation, as you were saying, that acute medical need. And then we're fantastic, best in the world. But there has to be a way for us to figure out the 100 steps that come before someone reaches that acute stage. And thankfully, we're getting more and more towards that. And you so wonderfully did early on in 99. I mean, that's amazing. Right now, they are starting to bring that Eastern medicine, that more external, other than type of medicine into the Western world. And so a lot of our guests do end up repeating that same refrain. And so it's really something.
Yeah. It's interesting to see that, the physicians who have, I guess that's why we call it practice, right? We have, we get to that as we're practicing on this and figuring it out. And the truth is that if you look at the standard Western modern medicine toolbox, to fix things, you open up that toolbox, that first tray is procedures like surgeries and things like that, right? And if you don't need surgery, you take out that tray. The only thing left in the toolbox are pharmaceuticals, are medications. There's nothing else really in our toolbox, and that's that's sad. And part of the thing is a lot of this stuff isn't reimbursed very well, from an insurance standpoint. Procedures are, devices and procedures are reimbursed incredibly well. So there's a lot of incentive to develop devices. And, I'll give you an example. I was at the FDA for 2 years. And one of the big things there is right now, there's the development of a lot of vagal nerve stimulating devices. These are implantable devices that stimulate the vagus nerve because there's studies now that show parasympathetic stimulation, stimulating the vagus nerve, it has incredible health benefits. I mean, it's beneficial for hypertension, for heart disease, for stroke rehab, for heart failure, for depression, for autoimmune disease. There's studies that show that multiple sclerosis and rheumatoid arthritis respond to these vagal nerve stimulators. And these companies are developing these devices that are surgically implanted. They're devices that are probably on average are going to cost about $50,000 for the procedure and the devices and everything. And as you all know, there are other ways to stimulate the vagus nerve, like humming,
Right.
meditation, mindfulness, humming, singing, and but you're not going to get $50,000 to teach people how to hum. So,
unfortunately, or we'd all be rich.
Right.
Well,
Yeah.
Dr. Julius, it was what you had said earlier, like with that first patient, you became human and you just sat there and spent the time to talk to her. In today's modern medicine, like from Canada, where I'm originally from, I'm in Mexico right now, but the doctor's appointments are 15 minutes long and you're allowed to talk about one issue only. That's it, that's all. In 15 minutes, there's no time for the doctor to be
No.
human and have a conversation. He's got time for you to list your symptoms and him to write the prescription, right?
Yeah. I mean, in again, the 40 years I've been doing this, it is it's sad because as we talked about in the beginning, the technology, the improvement in technology it's unbelievable. It's absolutely unbelievable. And in all of that acute sort of stuff, I think, things have improved incredibly and moved forward. Unfortunately, I think actually healthcare has deteriorated in the 40 years professionally that I've seen. And that's the sad part is because exactly, as you were saying, Cynthia, it is, like pharmaceutical-based medicine is so easy, right? Like you literally can go in, you see the patient, they've been weighed, they've had their blood pressure taken. Maybe you have their labs there in front of them. You say, look, your blood pressure's too high, your cholesterol's too high, your sugar's too high. We're going to put you on these 2 or 3 or 8 or 12 medicines,
Oh,
and I'll see you back in 6 weeks or 3 months. And that's like the visit. That's literally the visit. So what I call pharmaceutical-based medicine like very easy. It just doesn't work. And when I say it doesn't work, it's not true. I'm not against the medicines. Like if you're having migraine headaches, right? The medicines are pretty effective for pain or even for prevention of migraine headaches. I don't have an issue with the medicines, but what I'm saying is that the medicines aren't getting to the root cause of the issue.
Yeah.
And so take the medicine fine because it's hard to do anything else when you're having a migraine headache or miserable, but work on the root causes and find out where is it. So I think, like from my standpoint, everyone with migraine headaches should be seeing a therapist, a counselor. Like it should be a given. Yet if you look at the number of people with migraines that see counselors, it's a very small, I don't know what the percentage is, but I'll bet it's less than 10%. It's a very small percentage. And that's, some of the other issues like irritable bowel is another good example. The medicines are not that effective with irritable bowel. We know that there's an emotional component. There may be a nutritional component as well, and sometimes nutritional therapy. Very important. Everyone with irritable bowel should be seeing some kind of nutritionist who probably specializes in that. But in addition to that, you need to be doing something to deal with this emotional issue.
Mm-hmm.
Absolutely. We do have a diagnosis-heavy healthcare system too, and that's a little worrisome because when you're a hammer, you're always going to look for a nail. And so the healthcare system is set up to where, as a doctor, you want to be able to have something diagnosable so that you can then move on to either procedures or prescriptions. And that's kind of the way it's set up. And unfortunately, it may not be that, as you were saying. Like I was diagnosed with irritable bowel syndrome about maybe 15 years ago, but that's not what I had. I ended up fixing it myself. And what it was is I was intolerant to high fructose corn syrup. And when you're trying to do a food withhold, you'll find that that is in almost everything. And it took me quite a while to figure it out. And I accidentally figured it out. The only reason I figured it out was because I liked this iced tea. And so I'm sitting here thinking that this flavored green iced tea was like healthy, and come to find out that they made it with the high fruit. And it was like, oh, wait a minute. Maybe that's this other stuff that I'm taking has that. And once I figured out that that's what it was, I eliminated it from all of my food. I never take it. And voila, no IBS. So, so I didn't need medication or anything, but it could be very devastating to go with a diagnosis and behave in such a way when that's not really your issue.
Yeah, we're not very good when, as you also suggested, like our background in nutrition is negligible, and we just don't pay nearly enough attention, to these sort of things. And it is a shame, but yes, I have seen that as well. I used to an exercise physiologist that trained cyclists, and they have, at the end of these long cycling, they have these energy packets, and some of them would develop irritable bowel kind of symptoms with horrendous, stomach cramps and diarrhea, which is a terrible thing while you're riding your bike.
Couldn't imagine.
And it turned out we found that most of those had high fructose corn syrup in it, and once we eliminated that, they could keep riding.
Right. Well, I have to commend you for way back when not treating that woman that was in your office as someone who was making it up all in their head, because we have known many women who go to the doctor and they have this list of symptoms. They're ill, and I mean physically ill, practically real daily life, sick, and just to have a doctor. And before I say this, we love doctors.
Yeah.
It's not that we're bashing doctors. It's that there's something broken in our system, and the doctors are victims to that as well. And to have a doctor look you in the eye and say it's all in your head is just devastating to women when they are going through so much suffering. And that's part of what we do here. And so I have to commend you for not thinking that way when that lady was broken down in front of you and she was having real issues in her life and having real physical results from that, and that you just took the time to hear her out, because sometimes that's all any of us really need, is someone to acknowledge us, to listen to us, and to empathize with our situation.
Yeah, that's one of the things in medical school that is really unfortunate, disappointing, is the amount of education you get or time with regard to communication
Mhm.
and the, I would call it like presence. And so I learned this in some ways from my mentors, the good ones and the bad ones, more bad ones than good ones. But like, some physicians, as you guys, I'm sure, have experienced or have heard, like they hardly walk into the room. Like if they walk in the room, they're sitting at the door, like with their hand on the doorknob, and they may not even sit down. And if they do sit down, especially today, they've got the computer and all that kind of stuff.
Yep.
And they're just going through, the checklists and things like that. And they're just not present. And that gets conveyed energetically somehow, right? To people, and it comes across as though they don't care. And I know a lot of physicians, and they're very caring individuals, but they're trying to get through their day. As Cynthia was saying, they've got this list of 30 patients they've got to see that day. They've got 10 or 15-minute appointments, and
Mhm.
they're always behind, and they've got to get through this, and it's just very stressful. And it's unfortunate because I think physicians have allowed this to happen, like and we and it's instead of as reimbursements have gone down, we just got more efficient and just saw more patients to maintain the revenue that we were used to. And it's just eh, it's sort of sad to watch, especially over the years, as I say, and I see it in the hospital as well as the office, unfortunately.
Well,
Dr. Julius, I had shared I'm in Mexico. I was born and raised in Canada. It's very sad that the wealthiest countries, the US and Canada, that, like you said, your reimbursements are going down. And it's not even that doctors want to keep their lifestyle, their expenses are going up. So there, it becomes a numbers thing. Well, down
Uh,
here in Mexico, it's a cash medical society. So when I go to see a doctor, he spends the time with me. They're sitting down, they're looking me in the eyes. This is the first doctor I saw that actually said to me in the middle of menopause, let's test your hormones, because he spent the time. And so it's very sad that it's come, yeah, the system is broken. It's not so much, we're not talking about the doctors, it's the time. Like it's trying to get the reimbursements with the expenses to actually
yeah.
make a living too.
Yeah, it's very expensive to run an office. You got to have an electronic medical record, very expensive. The equipment that you have to have. I had in my solo practice, I had over $700,000 in equipment. So
Yeah.
between ultrasound machines and nuclear cameras and things like that. So it's a big business, no question, and you have to have the volume to maintain, to meet your payroll at the end of the month. And so there is a business to it, and again, it's I don't have the answer. I used to I used to think medicine was expensive 30 years ago, and I didn't think it was sustainable 20 years ago. And yet here we are, and it's 10 times more expensive today than it was 20 years ago. I mean, we have medicines today that are, tens of thousands of dollars to hundreds of thousands of dollars. And, we didn't have that 20 years ago.
No, that's criminal to me.
Well, let's talk a little bit. You mentioned in your notes about medically unexplained symptoms. So when someone comes to you and they are experienced, as we've been talking about, all of these symptoms, and they're not immediately explained by any particular diagnoses or test or anything like that, how do you begin looking deeper into what might actually be going on? What are your steps? I mean, have you come up with this process now because you've been aware of this as, okay, now that that's all taken care of, here's what we do, here's how we start?
Yeah. So I actually call it awareness-centered medicine, or awareness-centered health. And so, but it actually starts on the first visit. So if someone comes in like with chest pain or palpitations, as an example, since I'm a cardiologist, it's obviously a lot of what I would see. The first thing you get is a standard medical, modern Western medicine evaluation because, heart
Right.
disease is common, right? And so we want to make sure you're not having a heart attack, make sure you don't have unstable angina, make sure you don't have heart disease or some valve issue or something like that. So you're going to get the standard thing. But in addition, to that, during that time, there's I also look, basically get an assessment, an idea at least, even though it may not be in depth at that time, an assessment of, hey, who are you? What's going on in your life, right? And at least get an idea there. And then we go ahead with the standard evaluation, which 85% of the time, we don't find anything. And so then it's sitting down and basically, okay, all your tests are normal, as you suggested. And it's funny when you say that, especially because some patients kind of like there's almost a dejection on their face, like, oh God, you didn't find anything. And I'm like, no, you don't understand. You don't want us to find anything because if we find something, it's not good generally. Okay, so it's good that we didn't find anything, right? So that's and you gotta get that out, believe it or not, because people are like they want you to find something, but they want it to be treatable. Right? And then we start with, basically what's going on in your life, and we look at it from every standpoint, right? From home life and what's going on in your home life to work life to your children to your marriage to work, because it's all of this stuff shows up differently in different people, right? And it can be pretty much anywhere. But and frequently it doesn't matter where it is, you sort of address it. But what I have found is once you get really into the deep, it almost always comes back to self-worth issues, self-esteem issues, shame kind of issues. Virtually, I don't want to say 100% of the time because nothing's 100%, but very commonly, those are the issues. And then how do you work with that? And that becomes a little bit of a challenge. And then, as I was looking, what are things out there that, can be helpful, beneficial, therapeutic, whatever you want to call it, I came across gratitude. So gratitude, there's a whole body of literature that shows the health benefits of gratitude. Like it blew my mind. Gratitude helps people recover more quickly from illness and medical procedures. Gratitude helps in reducing illness symptoms. It reduces pain levels, enhances immune function, improves sleep quality. People who practice gratitude, they have increased resilience. They cope more effectively with stress. They tend to be more optimistic. They have less anxiety, less depression. And when I saw that, it was like, why aren't we prescribing gratitude to everybody, right? And so I started doing that, literally prescribing gratitude and ways to do that. And so developed, started with gratitude journaling, but over time, I was doing this myself. I found gratitude journaling, I don't want to say ineffective because there's definitely an effect, but the literature also shows that it's not just the quantity of the gratitude, but it's also the quality of the gratitude.
Yeah.
So the problem with gratitude journaling, from my perspective, is a lot of time it's just we just do it rotely. Like you're going to bed at night, you're laying down. Oh, I forgot to do my gratitude journal. You get up and you write 3 or 5 things, that you're grateful for. I'm grateful for my family and I'm grateful for my food, whatever, right? And I'm not saying that's not beneficial, but if you can experience more what I like to call awe-inspiring gratitude, where you get that, I like to call it the warm fuzzy kind of feeling. That is more beneficial. And so I have this technique that sort of developed over time I call it the trace back method, gratitude trace back method. that helps people really become more and develop that awe-inspiring gratitude. It came from my own practice, where I was literally, this was again back in the late 90s, and I was trying to do the gratitude stuff because I had seen, that there were benefits. And I was really depressed at the time, and it was a Friday night. I was driving home, and I remembered there was nothing to eat at home, and I had to stop by the grocery store. And I stopped at this grocery store, and I remember pulling in, and I was just really miserable. And I was finding things to be grateful for, and it just, wasn't sort of cutting it. And I love going to the grocery store. I love food. I love shopping. I love looking at fresh produce, and I love thinking about how I'm going to cut it and clean it and cook it and what pots I'm going to use. I love all of it. And so I went in the grocery store on Friday night. Now it's like 7 or 8 o'clock at night, so it's empty, right? No one goes to the grocery store on Friday night, except for kooky people like me, maybe a couple teenagers buying beer or something, And the grocery store was virtually empty. And I walked into the produce section, which you generally do, and all of a sudden I just became overwhelmed with this idea, this concept, that all of a sudden, and it was like the beginning of fall, end of summer, and so the stuff was really just great, fresh looking. And I just remember becoming overwhelmed with this gratitude of, oh my, I'm like, this whatever tomato, like I didn't have to go plant the seed. I didn't have to till the soil. I didn't have to like weed it. I didn't have to, wait for it to grow. I didn't have to go pick it. It's just here. It's available for me. I just have to buy it, and I can take it home. And all of this other produce, is available for me, and I can have any of this. And I like, it started, tears came to my eyes. And then, and then I ended up in the bread aisle and started bawling because there was 50 or I don't know how many different kinds of bread. And I was like, oh my God. I said, I didn't have to go plant the wheat and till the soil and wait for the wheat to grow and buy tractors and stuff to harvest the wheat and separate out the wheat from the shaft and mill the wheat into flour and then take the flour and turn it into dough and wait for it to rise and bake it. I can just buy this bread, because I was before complaining that it was $5 or $6 for that loaf of bread. And I'm like, I started to realize as I went back all of the logistics, all the resources that was necessary for me to be able to have that loaf of bread in the grocery store available to me. All the things that had to happen for it to get there, the packaging, the baker who had to bake it, but you go back, the farmer who had to grow the wheat, and who had to, the miller who had to mill the wheat, and I started to like, I'm surprised this bread's not $250,
Right.
And so anyway, I became it was awe-inspiring for me, and so I started doing that as what I call the gratitude traceback method, and I found that to be particularly useful in getting that warm fuzzy feeling where it's basically a vagal response is what it is. It activates that parasympathetic nervous system side of the autonomic nervous system and calms the body down.
Well, I think that's beautiful. I mean, I can't have bread right now, so I cry in the bread aisle too.
For different reason.
I can totally relate.
Different reason, but we get it.
Right, right. So I love that you have you've started making your patients like active participants in their health rather than passively taking care. Is that correct?
Yeah. So that actually, as I was putting Gratefully Well together, I was saying, trying to say who would benefit from this. And what became obvious is that you have to be willing to be an active participant in your health and your health care. And what I mean by that is, especially in the United States, but it's common in the West in general, we turn after you do your own thing at home, let's just say you have headaches, right? You take your Tylenol or Advil or, aspirin, whatever it is, and it's not helping, or maybe they're recurrent, maybe they're worsening. You finally decide, I'm going to go to the doctor. Then when you do that, you essentially turn everything over to the physician, and you say, you have two things you expect from him or her. You expect him to either, one, figure out what's going on, and then two, fix it, right? And you take no responsibility of that. So if he says you have migraine headaches, that's what this is. You don't have a brain tumor. And so we have this medicine to prevent migraines, okay? And here's a medicine to treat the migraine if you get one while you're on the preventive, okay? And you're probably not sleeping well. That can cause, migraine. So we're going to give you this pill to help you sleep. And you probably depressed. You seem a little bit depressed. So we're going to give you this antidepressant. And you're probably anxious as well. So here's something, to sedative to help you relax. So here are these 5 medicines, and you just start taking those, and you know that these are probably stress related because everyone knows that headaches are related to stress. The doctor knows it, yet we're not doing anything to get to the foundational sort of issues. And so the truth is, I don't care what it is, whether it's, headaches or cancer for that matter. You need to be an active participant in your healthcare. You don't, not 100%, right? But you need to be able, like and diabetes is the greatest example, right? Type 2 diabetes in the United States right now is absolutely epidemic. And yes, you have to be genetically predisposed to diabetes. That's a given. However, you can modify the expression of those genes based on your lifestyle. And that lifestyle is, you basically, it's an inactive lifestyle is what it is. And so in type 2 diabetes, it's not that you don't make enough insulin like in type 1. Those kids need insulin. But in type 2 diabetes, it's actually insulin resistance. The insulin doesn't work as well. And so you make more insulin. So your body has too much insulin, not a lack of insulin. And that's a lifestyle issue. It's inactivity. It's, it's obesity. It's the food that you eat. And so the medicine is important. Again, I'm not saying not to take the medicine, especially today. Some of the medicines do help with the insulin resistance, so they're doing the right thing. But in addition to that, the medicines are not going to cure your diabetes. They're not going to reverse your diabetes. And you can reverse it. You can actually cure it if you would be an active participant and do those things, take the medicine and learn about all these other things. But the truth is, the doctors don't stress that either. The doctors will say, you need to exercise and lose weight. Well, as soon as you say that you need to exercise and lose weight, everyone thinks exercise. I got to go to the gym. I got to lift weights. I got to get on the treadmill, and I got to diet. I got to restrict what I'm eating. And so I got rid of those terms, and I would use activity instead of exercise and nutrition instead of diet. And so you need to live an active lifestyle. And so especially a lot of, middle-aged women who are busy, they're working, they've got a family, they've got kids, they're doing all this stuff. And they're like, I'm too busy to exercise. I'm like, okay, what if you got bikes and you all, rode bikes together? And they're like, okay, that's exercise, right? Plus you're spending time together, and that's beneficial in many ways besides just the activity, right? From a nutrition standpoint, yes, you might have to lose weight, but, look at what you're eating, look at how you're eating, as opposed to thinking about losing the weight. And then the last thing is, why are you overweight to begin with, right? Or if you smoke, right? Everyone says you tell your patients not to smoke. I'm like, everyone knows, like, you shouldn't smoke. What I'm more interested in is, why do you smoke, right? And you start to talk about that, and you find out most people do those things for relaxation, right? And you look about eating patterns and eating habits, and you find, there's a lot of nervous eating, or there's a lot of, people who eat late at night or whatever it is, right? And so it's just helping people understand, that sort of stuff. How to read a food label as an example, right? Things like
that. Yes, thank you for that. So before we close, I'd love to leave our listeners with a simple reflection. So if someone listening today wanted to start becoming more aware of what their body might be communicating to them, do you have a simple practice that maybe they could try this week to get started?
So I think one of the, I'll call it foundational issues, is we do not emphasize, maybe that's the best word, the importance of mindset as it relates to health. So mindset in our society today, it's like a buzzword, right? It's like we talk about it in the military, right? With all the elite units like the Navy SEALs, they talk about mindset. We talk about it in athletics and peak performance training, mindset. We talk about it with executives and, coaching them to, all about mindset. But we don't talk about it much in healthcare. And we have the placebo effect, which is all a mindset. I use the term mindset when it's really, instead of beliefs and thoughts, it's really thoughts and beliefs. But mindset is that buzzword that everyone sort of uses. And so and to start to understand that your thoughts can affect your physiology, right? So if you're sitting there and something happens, you hear a noise or something, you get startled, right? The first thing that happens is you jump up. If you measured your heart rate, it would be up. If you measured your blood pressure, it would be up. If you measured your sugar, it actually goes up, right? And so those are all mindset or thought-based kind of things. It wasn't, like you heard a noise and you said, "What was that?" And it was the thought that caused this shift. And so starting to pay attention to how your mindset is affecting your physiology and how it generally will stimulate the sympathetic part of your autonomic nervous system. That's the fight or flight response. That's the part that will raise your blood pressure, make you tense. It'll dilate your pupils. It basically is the fight or flight response, right? Which says, I'm going to be stronger so I can fight if I have to fight this saber-toothed tiger that's chasing me, or run faster, right? The problem, and that system is there. It's for safety. It works. It's a great thing. And it's not an issue as long as you were on the savannah and you got away from the saber-toothed tiger and now you can calm down. The problem in our society is that we never calm down, right? We're constantly stressed. So that sympathetic activity is always elevated. But if you just start to pay attention to how your thoughts / beliefs affect your physiology, and people just aren't mindful about how they're actually feeling, like to just sit and say, if you get tense before, a meeting, like you're at work, a committee meeting, or before you got to have a meeting with your boss, right? And you feel that sickness in your stomach maybe, or something like that. Or, you get an email that morning that says, from your boss, let me know when you have some time to talk today. Right. It's a neutral thing. Doesn't mean anything bad is coming, right? But maybe you get that sick feeling in your stomach. To pay attention to that and start to see how those beliefs and thoughts affect your body. And on my website, ungratefully-well.com, there is a free a 3-day physiology of thought mini course, that can at least start to get you thinking along these lines. So I think if there was one sort of thing in Gratefully Well, it's bringing mindset, the importance of mindset into health and healthcare.
Oh, thank you for that. Our listeners would love that. Ladies, any final thoughts?
No, I agree 1,000% with everything you just said. I love the terminology to be an active participant in your health. I think that is, that's the mic drop, right? Just you have to do that. So yeah, thank you so much. It was very much a pleasure having you on the show. Really liked listening to you talk. Yeah, good.
Thank you.
Thanks.
And I wanted to bring attention to the words that you kept using was, awe, grateful, pay attention. Your is awareness, awareness centered health, right? Like it's all about being aware. And the first two letters of awareness is AW, which is awe. I know there's no E, but that's the awe, grateful. It's the awareness, right? The opposite of the gratitude is worry. And 85% of the things we worry about don't even happen. You don't even have to hear a book drop for your system to be ignited. You just have to think about, what if I drive to work and I get in an accident, and your brain thinks you're in the accident, your whole system's ignited. So I like the way awareness, attention, awe, like exactly that, like mic drop Tracey, right? Like be active in your healing. So thank you, Dr. Julius.
Yeah, appreciate it. Yeah, the that mindfulness, right? And we know there's in the East, the mindfulness sort of practices have been around forever. And they've come here and they've come a long, long way. We've got mindfulness-based stress reduction. It's very useful in many things besides pain. It's just something we don't emphasize in the West. We ignore most of what's going on in our body until you end up in the hospital with, critical high blood pressure or something like that.
Yeah, exactly.
Well, thank you so much for joining us today and sharing your perspective and your insights. And to our listeners, if today's conversation resonated with you, take a moment and reflect on how your mind and body may be communicating with each other in ways you haven't noticed before. Sometimes the first step towards better health is simply learning to listen when our bodies are trying to tell us something. And remember, the path back to yourself is always there. The journey begins with your first step. Bye for now.
Bye.
Thank you.
Thanks for tuning in to the Happy Healthy Her podcast. If you enjoyed this episode, be sure to share it with anyone you think would benefit from the topics we're discussing. We'd love to hear from you. DM us with your thoughts, comments, or ideas for future episodes. And don't forget to check out the links in our bio if you'd like to connect with any of us or learn more about what we do. Until next time, remember, in a world where you can be anything, be kind, be happy, and be healthy.